Hey, this is Dr. Doreste with the Cranial Release Technique, back with a new video, trying out some new equipment, so fingers crossed all goes well. I recently completed a YouTube short where I discussed how cranial distortion, one side of the brain being overactive, causes distortion throughout the body, which can lead to a carrying of more weight on one side versus the other. So for people that have hip problems, knee problems, ankle problems, foot problems, more so on one side compared to the other, why is that? I mean, we use the feet and we use the legs. We walk. For every one step on the left, we do one step on the right. So there's got to be something else at play. I mean, unless it's some major trauma that you've had to that one knee or hip or ankle. So let's think about this for a moment. The cranium is distorted in most people. That cranial distortion, osseous, bony cranial distortion of the 22 cranial bones, will lead to a spinal distortion. The shoulders will be out of alignment, the pelvis will be out of alignment, and as I mentioned in the YouTube short that I just did the other day, an old trick that chiropractors would do would we would take two bathroom scales, put them together, have the patient stand 1 foot on the left scale, 1 foot on the right scale, and if you measure those amount of weight, it should be within 0 to 3 pounds. So if I'm on the two bathroom scales, I should be 115 on the left and 115 on the right. But you're probably going to see something they claim that if it's more than 5 pounds difference from one side to the other, that is significant. That means one leg is carrying much more weight than the other. And you multiply that by how many steps you do in a day, over a week, over a month, over a year, 2 years, 5 years, 10 years, and you could see how one extremity would wear out faster than the other. And you'd have more symptoms probably on that one side. So, in addition to going and getting the ankle looked at, the knee looked at, the hip looked at, you probably never thought to get the head looked at. And so, with cranial release, what we'll do is we'll balance the cranium with this 1 minute technique. We'll open, align all the cranial bones, which will help to align the spine. We'll balance the brain hemispheres from right to left from an electrical standpoint. We'll relax the covering of the brain and the spinal cord. That's called the dura mater. In addition to that, as each pair of nerves, as 31 pairs of nerves, as they branch out from the spinal cord, they're covered in an outer covering, kind of like the black rubber on a cable or a wire. That is the dura, which is now called the fascia, the superficial fascia. It's called the epineurium, which then, the technical term is epineurium, which then blends in and becomes the deep and superficial fascia. In addition to that, we'll balance the autonomic nervous system, the sympathetic, parasympathetic. The sympathetic, the fight or flight, the parasympathetic, more the rest, relax, and heal phase of the nervous system. And you need both. When you drive a car, sometimes you need the acceleration, sometimes you need the brake. And you do those in balance so that you can drive from here to the supermarket and back home. The beauty of the cranial release technique is that in this 1 minute technique, we're balancing all the structure and including those fascial components, the inner membranes that sort of hold things together and connect things throughout the body. And so I've had many patients that have come in with foot problems, ankle problems, heel problems, knee problems, leg problems, hip problems. And I would never touch the extremity. I would start with the cranial release to see what needed to be done after that. And I can tell you, after so many years of doing this, the majority of patients, after you apply the cranial release technique, that leg is much better without me even touching the leg, because I didn't touch it directly by my hands down on the joints. I touched it through the cranium, through aligning the body. And then if you take those people So we're aligning the osseous structure and the fascial components and the nervous system. Then you take those people, put them back on the scales, and now they're back within a pound or two or zero. So you changed how they're functioning in gravity. It really is an incredible concept, and someone just commented to me that they would never make that connection between the cranium and a leg issue, the cranium and a knee issue, the cranium and an ankle issue, the cranium and the hip issue. So, food for thought. The website is cranialrelease.com. I think you probably know that by now, cranialrelease.com. If you're watching this on YouTube, please like, share, subscribe so we can send this work all over the world to people who really need to understand this. At the website, back again at cranialrelease.com, you can click on the Find a Practitioner button. Hopefully there's someone in your area so that you can get on the table to experience cranial release. And if you're a practitioner out there and this has sparked some interest to say, well, wait a minute, maybe there is a cranial component to that knee problem, or maybe there is a cranial component to that digestive issue, or maybe there is a cranial component to that hormonal imbalance, or maybe there is a cranial component to that TMJ dysfunction, and you want to learn more about how do you as a practitioner learn this work. Back at the website, cranialrelease.com, there's a button called Online Training Program. You can click on that and take a look at the videos there and see if this is right for you. If it's right, welcome aboard. If it's not, well, we're still friends. See you down the road. This is Dr. Doreste with the Cranial Release Technique. Adios, my friends. Don't forget the cranium when the people come in with the knee, hip, and leg. And you can do that trick. Take 2 bathroom scales, put them together, have the patient put 1 foot on one on the other. Look at the difference in the weight. Should be within 0 to 3 pounds. If it's more than that, they're carrying more weight abnormally on one extremity as opposed to the other. Thanks so much for watching. Have a great day. Try my remote control. Make sure this is working. Adios, my friends. Ciao for now.